And welcome back to the show. Well, as kids return back to school and summer camp on the horizon in the coming months, educators and caregivers will be met with a number of challenges, and perhaps none as important and traumatic as child abuse. Instances of child abuse and neglect have been on the rise since the start of the pandemic, with children isolated at home for over a year, connected with others mostly through brief video calls and exchanges. Many instances of maltreatment and harm have gone unnoticed and sometimes even underreported. Here to share more with us is the New York Foundling's Vice President of Mental Health Services, Dr. Jessica Pesantez. And then also we've got the Senior Vice President for Mental Health Services, Dr. Ruth Gerson. And thank you both for being with us here on Open. And I guess I'll start first with you, Dr. Ruth. Share with us a little bit about child abuse. We hear the word, we hear the term, but some of us may not be so familiar as how child abuse is actually defined. So how would you put a definition on child abuse?
That's a great question. Unfortunately, we know that there are lots of different types of child abuse and that child abuse is very common. There's the things that we typically think about in terms of sexual abuse or physical abuse, but we often forget about neglect, or we forget about excessive corporal punishment or about emotional abuse. We know that these types of abuse are very common, and even families who really love their children and want to be good to their children, with the stress and strain of job losses and financial pressures and being stuck at home, that there is a lot more risk for child abuse happening during this pandemic.
A lot of children have actually had to suffer in child abuse, with numbers actually being underreported. How do we go about creating safe environments, and what are safe environments for young people?
Great question. I think that one thing that's been really important is that all involved in the system of care, as we call it, for the child, be creative about staying engaged and connected with them. Because as you say, our youth have been indoors, out of routine, lack of outlets, especially those that are living in areas with even limited outdoor space. I know for us, who we work primarily with youth in care, in foster care, our psychotherapists have been creative about adapting the ways that they engage with youth virtually, and even doing things outdoors. So the most important thing is to maintain engagement and connection with the youth so they feel comfortable regardless of whether or not their routine has changed, their different opportunities to engage with other youth, go to school have changed, but they still feel that safe link, so to speak, with someone that they can trust, so they're able to express themselves and talk about what's going on.
Dr. Ruth, talk to me a little bit about building trust. That's important, right? And when we look at kids who've been in isolation for a long period of time, there's a lack of trust and sometimes some skepticism. How do you go about authentically building trust with a young person?
It's such a challenge, you're right, because they have realistically oftentimes experiences that make them wary or that make them uncertain whether this adult is really going to help them. And I think it's all about being really honest and transparent about what we can and cannot do, and being honest and transparent about what may happen, or what steps we as the adult will take, or what might come forth from a conversation, giving young people choices about how they talk to you. Do you want to talk over Zoom, or do you want to talk on the phone? Do you want to talk about this here, or would it be better to go outside? Do you want to type this with me because I see that there's other people in the room behind you, and I recognize that might make it hard to feel like you can have this safe space to talk with me. Giving them that sense of control and trust, respecting when they're resistant to talking about things or to opening up about things, because as you said, they have very good reasons oftentimes for being skeptical or uncertain about whether they can trust the adult. And sometimes we're talking about teenagers who just have a natural sort of, suspicion sometimes of adults that's totally age appropriate. We need to prove to them that we are trustworthy through our actions and through respecting them and their choices.
For the average common person, how do we actually identify what are these signs of child abuse? Because You can see a child, and the child could be acting out. The child could actually be quiet, and we're great labelers, if you will, of when we see somebody. We do our own self-diagnosis, but we can be very wrong in that diagnosis, not knowing the fact that a child could actually be being abused. What are some of the awareness signs that we need to pay attention to know if a young person is being abused?
The main thing that we speak with parents, guardians, other adults in children's lives to look for are any changes in behavior, any changes in the way that a youth expresses themselves. I think that in terms of focusing on change is something that's easy, so to speak, for people to be on the lookout for. And this way, someone's not just focusing on a particular behavior, because what we see is that depending on the kind of personality that a youth has or what their experience is, they might react or respond to abuse by crying. They might respond by fighting. So we really try not to specify a particular behavior to look for, but rather a change in behavior. As we all know, that people express themselves in different ways, and oftentimes adults in particular have difficulty, or it's hard to have patience with youth when they are fighting or acting out in an aggressive manner. But as professionals, what we know from research and experience is that such displays of behavior are actually quite common for those for youth that have been abused or have been exposed to other trauma or experienced loss, which is has been very common, especially over this past year. So.
Yeah. And what's it been like for both of you during the course of this past year? I reported earlier that we're in a time right now with a pandemic. Reporting of child abuse is going to be at an all-time low, simply because you're at home and you're in possibly that abuser's atmosphere. What's it been like in terms of trying to stay connected and also provide services for young people during a time when we really are in a place of isolation?
It has been hard. There's been so many barriers, even when we are, ready and engaged and available to provide telehealth services or to come to the communities where youth are and meet with them outside. It's been difficult. In the winter, it was hard to do outdoor work, and our technology is still not perfect. We have a lot of kids who don't have access to Wi-Fi or who don't have access to, smartphones with minutes so that they can talk with us. And our staff have had to be really, really creative in trying to find ways to connect with youth despite those barriers. And I think as much as it has been incredibly difficult and really disheartening in so many ways to see how hard it is, it's also really inspiring to me to see just how committed and how dedicated and how creative our therapists and other staff are to really making sure that they're able to connect with youth despite those things. And then to see the youth responding.
Yeah. Can you share a little bit about the New York Foundling's Child Welfare Program and what you got going on?
We feel really proud of the fact that we're able to provide somewhat of a continuum of services. So when we talk about child welfare, there's different levels of care and support that youth and families need. So for example, we have preventive programming and a number of different kinds of treatment models that are, evidence-based on previous research and data. And well, that is consistent throughout, but we have those preventive programs that really focus on maintaining the youth in the home to prevent disruption to the family or removal of the youth from the home. And but there are times, as we know, that the youth is not safe in a particular environment and may be removed. And at that point, we have a very strong foster care program, mental health services, variety of mental health services that we provide to our youth in foster care. And the state actually requires comprehensive services to make sure that youth are receiving the quality of care, regardless of where they live, who they live with, and we can, for example, provide individual psychotherapy or group psychotherapy. So again, throughout their time in foster care, we provide those kinds of services. And then once they're discharged from foster care, we maintain a connection and again, make sure that they're set up in the community. They might still require and still be involved with child welfare services. So we're able to, as an agency, support from point A, from start to finish, so to speak.
And before we leave, for someone, a parent out there that may be struggling, or somebody that's a caregiver that recognizes they have a child in need, what would be the best possible advice that you would give them?
Well, I would say trust that instinct. Parents know what they need and what their kids need more than anybody. And there's no shame. We are all struggling. As a parent, I say we are all struggling. I put myself in that category in this really difficult time to be the kinds of parents that we want to be. And as Jessica said, I think one of the best, most sort of core values that we have at this agency is that we want to help families be the best parents that they want to be, to sort of achieve that vision for themselves. And we have so many different types of family support services that are available. So I would say reach out, give us a call. We're happy to help you think about what kinds of services that we provide would be right for you, or perhaps, find something in another agency if we don't provide exactly what you need.
Well, Dr. Ruth Gerson, thank you so much. Dr. Jessica Pesantez, thank you so much for being with us here and sharing with us here on Open as we find out more information during a very critical time as we learn more about child abuse. Thank you so much both for being here on the show.
Thanks for having us. Take care.
All righty. Well, I want you to know that if you want more information, what we do is we encourage you to go to their social media, and you can find them at the New York Foundling. Also, you can visit their website at newyorkfoundling.org. Now,